Have you been told that your discs are damaged and now you're stuck in pain forever? Or maybe you've been told that you have something like a disc herniation or an annular tear or your disc is slipped and the only solution for you is to have surgery. Well, friends, that's just not true. But you do have to know how to move them correctly. It's important to know that your discs can heal and they don't slip out of place, and you are not doomed to have this pain forever. Annular tears and degenerative changes are not automatic surgical cases. I will tell you that discs do heal differently after the age of 20 years old, and here's why that matters. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I believe that movement is life and you deserve both. All right, let's start with Disc Anatomy 101. What is a disc? The disc is the shock absorber that is in between the vertebrae in your spine. It's made up of multiple layers of fibrocartilage, which means it's tough, but it's also flexible. If you think about it, the vertebrae are bones, and bones do not bend, which means that all that motion you have in your back comes from the discs. Now, an annular tear is when the outer layer of the discs are damaged. We like to talk about the disc as if it's a jelly donut, and it has kind of the soft, squishy stuff in the middle, and then the outside is firmer. It's not the best analogy because it's not 100% correct. However, it gives you an idea of what we're talking about if you're looking at something like a ruptured disc. That would be like when the jelly spurts out of the donut. Using this analogy, an annular tear would be if you tore off little pieces of the outside of the donut. Again, not the best analogy, but it gives you an idea of what is happening. You see, the outer fibers of the disc are all at different angles. And so what happens is that when you apply stress to them, all the different layers respond differently. So if you have a tear in one of the layers, it is going to change how you're able to deal with the stress through that motion. Now, discs require movement in order to be able to heal, but it has to be the correct movement. Improper movement patterns actually cause increased stress to the disc and can cause things like ruptures or annular tears. The reason why there's a change after the age of 20 is basically after 20 years old, gravity has pushed down on our head for long enough that we do not have direct blood supply to the disc, which means the disc needs to get its nutrition through a process called imbibition. Now that's a big word, but basically what it means is that the disc is like a sponge. It has to be squeezed out, and then it has to be able to release in order to absorb the nutrients from the surrounding tissues. So what causes that squeezing out and that release so that it can absorb the nutrients? Well, that would be called compression and decompression. Again, if we go back to that sponge analogy, think of when you compress the sponge, the water comes out. When you decompress the sponge and put it underneath a faucet, the water can go back into the sponge. This is why I get so frustrated when doctors tell patients that they need to rest when they have low back pain. Now, I do agree that you should rest from abnormal movements that are causing increased stress to your disc. However, resting and laying on the couch and not doing anything will not help the discs to be able to heal on their own. That's why sitting on the couch will not relieve your low back pain. And a lot of people will also ask me about things like bracing. Should I brace if I have low back pain or an annular tear or a disc herniation? Now, the truth of the matter is I don't believe that bracing really keeps you from doing normal movement. I think it helps to increase the proprioception or the brain's awareness of the movement, which may be helpful because it may keep you from doing the bad movements that are increasing your pain and furthering your disc issue. You may find that your body is even trying to brace things naturally, which I call this the robot move. If you feel like you're walking like a robot, it may be due to the fact that you have pain in the disc and the body is trying to protect it naturally, which is a normal response. However, we do want to make sure that we can move but move correctly. Now, don't go thinking that I'm asking you to bend forward and reach your toes or do back bends or really extreme ranges of motion. The most important motion to get back if you have a disc injury that you are trying to heal is rotation. Now, I understand. If you have watched other YouTube videos, they have probably told you to avoid rotation. I don't know why they do this. Please don't ask me to explain it, because rotation is the most important motion that we can actually do for our discs. You see, remember we talked about how all of those fibers are oriented in different directions on the outside of the disc. Well, rotation is what causes that compression, so all the waste material comes out of the disc, and that decompression, so all the good material can come back into the disc. So when you rotate to one side, it causes that compression, everything squeezes out. When you come back to neutral, you're absorbing all of those nutrients. There is a caveat though. You do have to do this with normal biomechanics, and you do have to do this in a pain-free range of motion. I have patients who get really, really motivated about rotation, and they're like, okay, I'm gonna rotate just as far as I can, but they're wincing in pain as they do that. Well, if you're wincing in pain, that means those muscles are gonna tighten up. And when the muscles in the low back tighten up, that causes compression on those discs. And when the discs are compressed, they can get rid of the waste material, but they cannot absorb the healing products that they need. So it has to be pain-free, and it has to be in the correct range of motion. The other risk, if you rotate too far and cause pain, is not only that the big muscles will take over and cause that compression so that the disc can't actually heal, but the little muscles will shut off. And you have little muscles in your spine. They're called the multifidi, and they're like the guide wires of the spine. They keep the joints from slamming down, which helps to decrease the pain. However, they're also super lazy. So whenever the big muscles take over, the little muscles just stop working. So then if you're trying to do any kind of motion and you don't have those little muscles, which are the guide wires keeping the joint from slamming down on itself, then that's going to be painful. And then the big muscles will take over more, which will cause more compression, which means the discs don't heal, and you're in this negative spiral. So it is critically important that you do this in the correct position and that you do this pain-free. So how do you know if you're in the correct position? You want to be sitting on a stable surface, and you want to make sure you have equal weight through both of your cheeks. You want to make sure that your head is on top of your shoulders and your shoulders are on top of your hips. You want to avoid twisting just through your low back. Go ahead and use your upper back, and you can even use your head too to make sure you're not torquing on your neck. And if you really pay close attention, you may even feel that subtle activation of the multifidi. Those little muscles are really, really deep, so you really have to listen for them. And potentially most importantly, the motion should feel smooth and not forced. So the easiest way to do this is when you're in sitting. What you're gonna do is make sure you're in a firm chair with your feet planted on the ground with equal weight through your feet, planted on the ground, equal weight through your cheeks on that chair. You want to make sure that your head is on top of your shoulders and your shoulders are on top of your hips. I like to cross my arms over my chest. If you have your arms out front, that can be a huge lever arm, which can actually increase tension on your low back. In fact, you can even try it right now. Sitting there with your arms across your chest in that proper position, feel how your low back feels, and then put your arms out straight. And probably what you will feel is that there's more activation of those big muscles in the low back, and it may actually cause your pain. So keep those arms here while you're starting this exercise. Next, what you're going to do is turn as far as you can without increasing pain to one side, then coming back to neutral, nice, slow and steady, and you're gonna turn to the other side. Again, as far as you feel comfortable with. You wanna be turning with your entire spine. You can turn your head along with it, and back, and over to the other side, slow and steady, and back. Now, remember I said you can only go as far as you can pain-free. And for some people, even that range of motion could be painful when you're starting out. So if that's you and you're like, yeah, I can only go that far pain-free, then that's as far as you go. You go as far as you can pain-free, staying slow and steady. Hopefully, as you're able to do more repetitions, you'll be able to do more motion. With this exercise, you want to do 20 to each side, so 40 total, depending on how you want to count. And then stand up, walk around, and see how your low back feels. You should feel more engagement in your low back. You should feel like you're more stable in your low back, and your pain should be decreased. If you have increased pain, it may be due to the fact that you went too far, or that your pelvis is not in the correct position, or that you're not able right now to stack your head over your shoulders and your shoulders over your hips. If that's you and it increases your pain, then you need to stop doing this exercise for right now until you can get in that correct position, because you might be increasing the stress to the disc and actually increasing damage. Remember, it's important to have a proper rotational movement, and not everybody can get into that position. And that may be due to pain, that may be due to a structural malalignment issue. There could be a lot of different reasons why you're struggling to get into that correct position. And if that's you, then I highly recommend finding a specialist who can understand what your limitations are for getting into that correct position. Because if you're staying in a pain-free range of motion and you're starting in the correct posture, this should be an exercise that does help to decrease your pain for a short period of time. Now, I will usually have people do this exercise 20 to each side or 40 total, depending on how you want to count, every single hour of the day. This helps to bring nutrition to the disc. This helps to activate those multifidi, or those small guide wires. It helps to decrease tension in the big muscles and is a short-term pain reliever. That leads to long-term results because, again, this exercise actually helps to heal the disc. But if right now you're not able to do this exercise because it does cause pain or you can't get into that proper position, I have some ideas for things you can do too. You want to start doing some breath work or some diaphragmatic breathing or some belly breathing, whatever you want to call it. You want to focus on your breathing because that will help you get into that neutral spine. You can use gentle contractions of your abdominals or your hip muscles to try to get those muscles activated a little bit more to help support your lumbar spine. Any pain-free, gentle motion that you can do that doesn't increase your symptoms or cause you pain while you're doing it is safe to do. Because the important thing is that you need to calm the system down. When things are really flared up, it really activates that fight or flight response. We have that pain response, and the body is on high alert. So doing things like breath work, doing that pain-free motion, doing what you can to calm the system down will help you be able to tolerate those exercises that will actually help to heal the disc. Please remember, discs do not heal with rest. They heal with the proper movement pattern. And rotation done correctly is your best tool to healing your disc. If you can learn the proper form, activate your stabilizers, it can help you avoid an unnecessary surgery. If you want to find out more information about disc healing, then I'm going to encourage you to watch this video over here, where I share my favorite story from a surgical observation I did while I was getting my PhD.